Hello, everyone. My name is Kelly Jenkins, and I am a registered nurse. And today I'd like to present some information to you about epigenetics and precision medicine as it relates to metastatic melanoma. So, exactly 1 year ago, tomorrow actually, my father-in-law was diagnosed with cancer. After suffering a seizure and having imaging which revealed multiple brain tumors and a few lung masses, he had surgery to undergo the removal of the largest brain mass, which actually led to the diagnosis of stage 4 metastatic melanoma. As with any news of a complex or potentially life-threatening diagnosis in a loved one, I really just wanted to learn more about the disease. So that's why it was kind of a no-brainer for me to choose this topic for the presentation. So here's a little bit of background on melanoma. Skin cancer, including all types, is the most commonly diagnosed form of cancer in the United States, but invasive or cutaneous melanoma actually only accounts for anywhere from 1 to 5% of all of those cases. However, it is responsible for 75% of all deaths from skin cancer. So, what is melanoma? Melanoma occurs when the cells that produce pigment in our skin, called melanocytes, actually mutate in a way that they're not supposed to. And the primary risk factors for melanoma include excessive UV radiation through sun exposure or tanning beds, but there have also been links to gender, occurring more in males than females, age, obviously the older you are, genetics and family history, occurring more in individuals who actually have a larger percentage of moles in their body, and more in individuals who have a already weakened immune system secondary to another disease process, such as like an autoimmune condition or things like HIV/AIDS. So in the past, and even still, surgery is the primary treatment for melanoma, particularly in early stages of melanoma. But when it's metastasized to other organ systems like lungs, brain, bone, that may not always be an option, or it may not always be the sole method of treatment. So in recent years, newer therapies have been made available in large part due to epigenetics and precision medicine. So over the past decade or so, there have been multiple studies that have brought forward a lot of new information to help in developing of new treatments. So recent research findings have found that through the use of DNA sequencing, there are hundreds and hundreds of genes that are mutated in melanoma. And what this has done is this has allowed researchers to really look at what healthy DNA looks like compared to the DNA of an individual with melanoma. And one of the major findings that they've actually noticed is that there's substantial differences in methylation, which is basically when methyl groups are added or removed to a segment of DNA to actually change how that activity of that DNA is without changing the DNA sequence itself. So in melanoma patients, there can actually be hypermethylation or hypomethylation, which really changes how that DNA acts and functions to promote growth of these tumor cells. So one of the other things that they have noticed through DNA sequencing is that they've identified high frequency mutations on certain genes. So these are mutations that in certain types of cancer they see more frequently. So for melanoma, they are finding mutations with the BRAF gene, NRAS, and MITF, to name a few. So they're going to be targets for current treatment therapies. In addition, research has found that there are certain pathways that seem to be activated more in melanoma tumors, such as mitogen activated protein kinase, the MAPK pathway, or the PI3K pathway. There has also been findings in research that has shown sporadic loss of certain proteins in the translation process, as well as deregulation of the transcription process, which leads to loss of tumor suppressing genes, or upregulations of genes and proteins that increase expression of malignant cells. There have been a lot of beginning layers of research that have been identified for melanoma, and melanoma has a lot of moving parts because it's a cancer that has a high number of mutations. So research is going to kind of be ever evolving as they begin to learn more and more about this particular disease process. But over the past decade or so, one of the big treatment modalities that has come out for the treatment of melanoma is immune modulation therapy or immunotherapy. And so what this does is it essentially activates the patient's own immune system to fight cancer cells. And this type of treatment has brought hope of much longer survival for patients with metastatic melanoma. Of these therapies include checkpoint inhibitors, which actually target certain receptors on proteins such as CTLA4 or PD-1, and then there are also targeted therapy agents which inhibit certain tumor genes like the BRAF gene. What's about immunotherapy is that it does have a high rate of adverse events, especially with combo therapy, which is the use of 2 or more drugs. So essentially any itis that you can think of, whether it's colitis, pneumonitis, anything like that, is considered one of the biggest risks of taking these medications. So this really does highlight the need to perform diagnostic labs on patients so that they can identify individuals who are more likely to have favorable outcomes with these drugs. When we talk about diagnostics with melanoma, unfortunately, the reality is that it is most often diagnosed once it's reached stage 3 or 4. However, if an individual is lucky enough to catch an abnormal skin lesion early, the way that it is diagnosed is through biopsy typically. So either a punch biopsy, which is a small sample of the abnormal lesion, or surgical excision of the full lesion, both of which would be sent off to the lab for pathology for that to be reviewed under microscope and identify the type of skin cancer. There are also methods of identification such as dermoscopy, which is using specialized microscopes over top of the skin lesion or abnormal cells to identify what they are. For later stage melanoma cases, the diagnostics do change a little bit. Typically, in that case, it's identified once the melanoma has reached a different organ system or lymph node. So there would be lymph node dissections, and that would be sent for pathology, or tumor resection from wherever the distant tumor metastases has been, where they resect the entire tumor or parts of the tumor, and then send that off for identification as melanoma. So once an individual has been identified and diagnosed as having melanoma, they can now do this advanced genomic testing, which has kind of become the highlight of medicine in recent years. So what that does is it allows researchers, doctors, clinicians to identify targeted drug therapies that can be used for individuals. And the goal of these targeted drug therapies is to direct a drug at specific genetic features on the cancer cell while hopefully avoiding all of the healthy cells around them. Actually shown really great promising success in treatment, but there's still, quite a long ways to go. An outlook for melanoma treatment actually is, still really quite complex. And the reason for that is, the benefit of new therapies has been found to really be limited by the resistance of melanoma because those cells acquire such a high degree of mutation. And so one of the things that clinicians and researchers have found over recent years is that the development of therapy resistance has become quite a big hurdle to the treatment of melanoma. And so what they have found is implementing what are called drug holidays will help to delay the emergence of the resistance to treatment. Holiday is basically what they do is they hit a patient with a certain therapy and then they withdraw that therapy. And the goal is that taking away that particular drug will stress those tumor cells. And then they'll come back at a later date, hit the patient with either the same drug or another drug, and hopefully pull down or suppress those tumor cells even further. And it's really showed promising evidence so far. So that is going to just continue to be researched in clinical trials and hopefully find whether or not that's really going to truly be an effective method for treatment of melanoma. Some of the other things that they're testing in melanoma still is the use of combo therapies. So whether it's two or more drugs, actually up to four drugs at the same time, has been showing some relatively promising evidence as well. So there's also, numerous clinical trials in progress to test epigenetic drug therapies, and these essentially target certain proteins, or as I had mentioned earlier, talking about the methylation, these will modulate that methylation of DNA. So there's really a lot in progress in terms of the research for treatment of melanoma. And it certainly has a long way to go because melanoma is such a complex cancer, and it is ever evolving due to those just high number of mutations that occur on the cells. But research has made incredible progress so far, and I can only imagine if a decade has made the difference that it has thus far, what another decade will do in treatment. So, a decade ago, the diagnosis of metastatic melanoma for my father-in-law would have likely been a death sentence. But thanks to advances in treatment modalities due to epigenetics and precision medicine, we get to celebrate another full year of life with him tomorrow since his diagnosis. So I really hope that you got some great information from this presentation and gives you just something to think about when you think about how far we've come with medicine and how important genetics is to the treatment of different conditions. So thank you so much for listening.